Hi, this is Darnell Placewise coming back to you again from Delta County. I had an opportunity to sit down with mental health professionals from a kids clinic, Center for Mental Health, and Delta County Memorial Hospital to discuss COVID and the impacts to our mental health. We hope you enjoyed this video. So thank you for coming in this afternoon. I appreciate you taking time out of your busy schedules. Would you like to introduce yourself?
Thanks. I'm Stacy Delisle. I'm the Executive Director at a kids clinic, which is a school-based health center for Delta County. I'm also a licensed behavioral health therapist.
Perfect.
And I'm Becky Ela. I'm the Director for Behavioral Health for Delta County Memorial Hospital, and I'm a licensed clinical social worker.
My name is Richard Grace. I'm the Assistant Regional Director at the Center for Mental Health in Delta. I'm a licensed professional counselor.
Oh, well, welcome. We haven't had an opportunity to work with you yet.
Thank you.
So the purpose of our gathering today is to talk about mental health and what you're seeing in Delta County. So I'm going to kick it off with a question for you, Stacy. There's a lot of conversation around suicide rates being up from last year at this time, and that increase is being blamed predominantly on COVID-19. Is that what you're seeing and hearing as well?
Yeah, no, I think it's important to know that suicide rates, attempts have actually not increased during the pandemic, and that's based from the Office of Suicide Prevention out of the state of Colorado. Can certainly see why people are wanting to attribute that or believe that there's actually an increase, but they've actually remained pretty much the same. This time of year, suicidal ideation goes up, depression goes up as we head into holidays and the winter, and that's not uncommon, but actual suicide attempts, I believe attempts and completions have not actually gone up. So I think it's important that we recognize that, because we don't want to normalize that suicide is an appropriate response to the pandemic, right? Yeah. So we want to just clarify that. I would say from our own experience at a kids clinic that we are starting to see kiddos who are increasingly becoming more distressed and anxious and depressed as well. And suicide ideation is a risk factor out of those things, and so we're helping students and families to navigate that. But it's not actually increasing right now, which is good.
Yeah, that's great news, actually. COVID has absolutely taken a toll on everyone in America and around the world. And because there isn't an end date in sight, unfortunately, what are some of the things that we can do to help ourselves? How could we know that it's time to seek professional help if it's needed?
Gosh, I think kind of ongoing just feelings of being down, being stuck, feeling trapped, feeling hopeless. Like even if it's your normal day-to-day activity and nothing's changing, increased irritability, if you're losing sleep consistently, if you're engaging in risky behaviors more, like if you're drinking too much, you're starting to use other substances, if you're just not able to manage your fearful thoughts about COVID, or being able to parent and do school and check your kids' homework and make dinner. I mean, there's just a tremendous burden on parents right now, and we are asking people to do an inordinate amount of things with the same resources, if not less, than they had 7 months ago.
Yeah.
And it's very difficult for people, and so I feel like if you're stuck and you can't get out of it and you're irritable and people are commenting about that, that's time to seek help. And help can be going to your primary care doctor and saying, I'm stressed out and worried and I'm not sleeping. It can be all kinds of different things.
And so aside from that, are there other things that we can do as individuals?
Absolutely. I think we have really lofty ideas about what we need to do to get better, and those things are really simple. It's like staying engaged with people that we care about. It can be texting a friend that you haven't been in touch with throughout the day. It can be shouting out to your kid's teacher. I mean, we all do better in relationships, and that emotional support is huge, regardless of if it's over the phone, if it's texting, if it's Snapchatting, whatever that looks like. That's really important. Exercise is really important. You know, when we exercise and release endorphins, we feel better. And it doesn't have to be going to run 3 miles. It can be, you know, walking around your house for 10 minutes and getting in the sunshine and getting some fresh air and just kind of switching your perspective and getting out of your brain so much and getting more engaged in your senses. All those things make us feel better.
Yeah.
Of course.
It's a really easy time to be in your head, and so like, you know, during these times, if you're stuck in your head and you're ruminating and all these like anxious thoughts are coming, you know, it's a really good time to get out of your head and into your body through exercise or something. You know, and it doesn't have to be something like you said, large and grand. Like if you're feeling overwhelmed, you can stop and do 10 squats and like go back to your desk, or, you know, go back to whatever. I think the compound effect of like making small positive changes, like doing something every day, like it builds, you know, 0 times 0 is 0, but 0 times 0.1%, you know, it starts to compound over time, over like 7 days. So if you can do small things every day to kind of make yourself feel better and healthier, get out of your head and into your body. If you're stuck in your head, get into your body and do something. Those things will add up over time and make you feel a little better.
Yeah, I think you bring up a good point of something small every single day. Just make that little commitment, and it will build over time.
Yeah.
So I think people think, like you said, I gotta go run a mile,
Right.
Yeah.
and you know who can do that?
Baby steps.
Baby steps, exactly.
And I think right now, like, and you said it beautifully when you mentioned like simple things. Like right now is the time to go back to the simple things that bring us joy and gratitude, and pause in the moment. And like, what are those? What are the small things that bring you joy in your day, and where can you still find them right in today's world?
Yeah, and it will be more and more important, as you said, as we move into the holiday season.
Holiday season and the winter.
Yeah.
I also think I've talked with a lot of people just about, especially parents who are in this role of having to work. Maybe they're working from home. They're charged with making sure their kids are showing up for school online or at school, and it's just really managing our expectations about what we think we need to be doing and what we were doing a year ago, because so many of those things are just, they don't really matter, quite frankly, and they just add a burden of stress that's not necessary. And so like dialing it back and having things be less complicated, less of everything, is a really good way to just kind of take it one day at a time and focus on what's right in front of you, and then you do it again tomorrow. And we as a culture aren't used to doing that.
Right.
So.
And giving ourselves permission to do that. You know, like whether you need to like have your doctor write it on a prescription pad and like, or you can just, you know, have that mantra on your bathroom window or on your fridge or window, your bathroom mirror or your fridge. I don't know who's that bathroom window that you write on, but mirror. You know, like give yourself permission to like slow down and take a break or whatever it might be that you need to do to recharge.
Yeah, especially kids these days, they're a little parentified, you know, and they have to, they're either taking care of their younger siblings, and I think, like Stacy says, they need to just kind of step back and, you know, be a kid again, you know. I think just kind of directing and guiding them in that area.
Yeah.
It's very beneficial.
I think limiting our use of these things, whether it's for our kids or ourselves, and screen time. You know, if checking in on things all the time is causing you, or even just moderate amount of time is causing you anxiety, I'd like to ask myself and help my clients ask themselves, like, is this bringing value to your life? Like, is it bringing value to you? It's not? Okay, well, where can we start to scale back? You know, if it's adding value to my life and bringing me whatever it is I need, then okay, let's do more of that. So I think those are important questions to ask, like that people can just ask themselves, like, is this giving me value? What value is it? You know, like when you're overwhelmed in your thoughts, like, are these thoughts useful? Are they helpful? Are they true? Okay, well, if they're not, like those aren't, maybe we need to work on like thoughts that can be helpful and true and useful, right?
Yeah.
So those are just some things that like you can do to help yourself a little bit.
Yeah. So I'm going to shift gears a little bit and talk about kiddos. Kids are back in school or not. You know, they're flip-flopping, one day here, one day remote, at least for at the high school level. Elementary and middle school are back. But despite being back, as you alluded to, it's still really, really hard. What are you guys seeing and hearing right now?
I'll go first.
Okay.
Just to remind everybody, like a kids clinic serves the school district. We focus on 0 to 21. So I really can't speak for adults outside of like what parents tell us. I'll let you guys focus on that. But what we're seeing with kiddos and youths in the school is that we're really seeing an increase in risky relationship behaviors. So like, I'm not going to go into that, but like, kids are bored and impulsive, and so they're taking more risks than they would otherwise. And so we're just kind of seeing that on the rise right now. We're seeing emotional eating out of boredom is a little bit on the rise. So we're seeing kind of an increase in weight gain, unnecessary weight gain with some of our patients and families, just out of boredom with nothing to do. Impulsive behaviors and risky behaviors, again, out of nothing to do or perceived nothing to do. We're seeing a lot of people neglect some of their healthcare needs, like dental work, cleanings, those types of things, well visits. And then we're seeing some strains on family relationships, or some of like the more common complaints that we're getting when our families are coming in. So of course we're working to help our families and students address all of these needs, but I think people are just, they don't really feel at their best, and we're not at our best. We're not, like, that's not what's coming out. And so I think helping people get back to like the basics of like, let's put some of these things in place, let's feel good, we're gonna see changes in some of these things.
Yeah.
So I apologize real quick, we're also seeing an increase in substance use and a relapse, and I think that that's important, that's a big risk factor for suicide ideation and suicide attempts is substance use. So I think that's something to be on the lookout for, is changes in your kids. If you suspect they might be using, you have a reason for suspecting that, like don't dismiss it.
Yeah, we're seeing about the same, with the substance abuse and some of the decrease in socialization. And I think getting it back to the family unit, because it takes everybody in order to, everybody has to be on the same page in order to treat the identified client. So
Sure.
yeah.
Are you saying anything different?
No, I'm not, and I also, I'm not seeing a general trend. I guess that's what I'm seeing. Like, every student I talk to has a different story and a different experience. And if they're at home and they're online, there's a tremendous amount of students, at least so I'm more familiar with, kind of high school, middle school, who are doing online, and they're doing really well. And now some of these kids are going to be going back in person full time, and they're more anxious now, because they're more anxious about, am I going to be exposed? I don't do well in that learning environment anyway. And so I haven't seen enough of a trend with students to say, yeah, it looks like that.
I see.
Like literally every young person I talk to has a different story.
Yeah. And I think that's important to recognize, like, we might be seeing some trends just because of the populations we serve, but that regardless of what we're seeing, it's important to know that, like, people are impacted individually. So like there's that collective impact, but there's still that individual story and impact, and I may not fit into anything that we're seeing.
Right.
Because that's certainly true. There's always the one-offs and like people individually bring to that, how they're impacted. And I think as counselors, like, we all are trained and do a good job of like letting that drive the bus, but that we are definitely seeing some trends for sure. But I think the good part of that is we're seeing people ask for help.
Right.
Like, we're getting lots of referrals, and lots of those are driven by families and kiddos experiencing themselves and not coming necessarily from other people. So I think that's great.
That is.
That people know that where to go for help.
And so that brings up my next question. So you talk about substance abuse. What's their first stop? Like, you suspect your kiddo's getting high with their buddy, where do they go? What resources do they have to reach out to get the help for their kiddo and their family?
Yeah, I mean,
There's lots of
I mean, there's more than one. There's not any one. I don't think there's any one starting point. I don't think there's a wrong starting point. So I think if you can start with your primary care, that's often a great place to start. Of like, just they usually have a trusted relationship with the family and who would be the patient or the youth. So there's no wrong door in. Like, we're all like, if it's something that one agency can't treat, like, we're really good about referring out to somebody who can. But I think starting through primary care, I don't know if the center has youth substance use programs. That's definitely a lack in our community. But we certainly individual counseling. It would be really great if we had a really robust substance abuse treatment program here, particularly for our youth. But that just, to my knowledge, doesn't really exist. So you have to kind of piecemeal it together. But I think any avenue that you start, whether you come to the center, the kids clinic or to the hospital services, like you're gonna find a caring professional will know whether they can treat you or if they need to like seek other help and kind of try to piecemeal different like levels of services together. But I think as a parent of 2 teenage daughters, I guess one of them's 20 now, so she's not a teenager, but I think it's important to ask your kids and to know.
Yeah.
Like, and if you're recognizing something that you think, better to ask than to ignore before it builds and you're like, oh, I thought they seemed off, but now I know for sure. So
Yeah.
check in with them, be able to have those conversations in a non-threatening, non-punitive way,
Right.
so that they feel safe talking to you. But inquire about changes you're seeing in kiddos and friends and families right now. Like if you think they seem off, hey Becky, you didn't quite seem like yourself today. I just want to check in and make sure you're okay. A very safe, like open way for somebody to say, you know, I am okay, or actually I'm not, or whatever. But I don't think there's any wrong way to enter treatment or help. But your primary care is a good place to start.
Good.
Well, and I think your question, we were all quiet about that, and my first thought, like my first honest thought is, well, there isn't a lot here, you know, and that's, I mean,
Yeah.
if we lived where we had a bigger population where there was youth-specific substance abuse treatment, that would be a reality, but that just isn't here, and so we do have to piecemeal it together. And hopefully that landscape will change in the future, but it is what it is right now. So your question was met with silence because there's not a lot out there.
Yeah.
I mean, there's the withdrawal management unit in Montrose through the center.
Well,
but
River
those
Valley, right, does that too?
I'm talking about more like detox.
Oh,
Like a
detox.
withdrawal
Like
Not
withdrawal
management, okay.
management, right.
Not
And
that.
so, and I'm talking about use substances, so whatever that
Yep.
gamut is, not specifically opioids. And so, yeah, I mean, that is a huge, huge need in our county and in our judicial
Yeah.
district, for sure.
Yeah.
Yeah.
And one of my behavioral health therapists at a kids clinic is funded through a grant through CDPHE, and she's focused on substance use and prevention.
Oh.
And so, like, she's dedicated to doing those services in the school, and that's free of charge, like, because it's funded through a grant. So I do have Renee Joyce, who's an amazing therapist, and she's focused on Cedar Edge, Hotchkiss, Paonia areas, because Delta Schools has, they have 2 behavioral health professionals embedded in the school. So we've focused our efforts in the other outlying schools.
Yeah.
But we do have that as available
That's great.
more as prevention and like beginning phases. It's not full on treatment, but it's something, and we really are trying to focus our prevention efforts so that it never
Right.
gets to the place of treatment. So we have that, but it's not really the same as like
Right.
in treatment.
Right.
Yeah.
But it's something.
Yeah. Got it.
Yeah.
Well, hopefully we can collectively work on that and figure out how we can get some
Right.
additional resources here.
Right.
Yeah,
Yeah.
I mean,
Absolutely.
and even if they do come in the door, maybe the mom or dad brings them in, or the guardian brings them in for mental health symptoms. Usually that comes out, the substance abuse comes out in individual therapy
Right.
without the parents
Correct.
Yeah.
in the room, you know.
Yeah,
it's
sure.
like,
Yeah.
Oh, you know,
Right.
so, yeah, I've got to tell you, I was smoking pot with my friends, you know, that kind of stuff. So then you start digging in, so the
Absolutely.
Yeah.
individual therapy comes in.
Yeah. Rich, is the center doing any youth, like individual substance abuse treatment, or is it really just adults at this point?
It's mostly adults. In
Okay.
Montrose, we have an IOP program.
For adults or youth?
For adults.
Adults, okay.
Yeah, and then we just focus on individual therapy, and then we have the youth DBT, which could also be very beneficial
Yeah.
for the emotional dysregulation and the mindfulness.
Mhm.
Just for the audience recording, will you tell them what IOP and DBT is, so they know?
IOP is intensive outpatient, and DBT is dialectical behavioral therapy, and we have a youth. And you know that starting off an individual treatment is very helpful, but then when they get together in a group with their cohorts, they have similar sort of issues and concerns, and it's just, they're a little bit more likely to share things in the group setting, so.
Yeah.
More normalized.
Yeah.
Yeah.
Right.
Yeah. They don't
And you get
feel-
to practice, like, trying things out on the group before you take it to the real world.
Mhm.
Yeah.
So group is a great
Sure,
thing.
yeah.
People are hesitant about it, but I love
Yeah.
group.
Yeah,
Yeah.
So you bring up my next point. Support groups. Can you talk a little bit about the different support groups that Center for Mental Health has for families?
You know, a big thing is NAMI, of course, and I think the
Which
closest
is?
one is Grand Junction, that's the National Alliance on Mental Illness. Yeah, and I think psychoeducation works, informing family members about what's going on with the kid, that they know about the symptoms, what to look for, and then have it sort of kind of assess appropriately when they're in the home, and then bringing that information to to the therapist or the psychiatrist or whoever else involved. But regarding groups, we'll support on the individual basis, but we do have the youth dialectical behavioral therapy for support as well.
I think one of the things that has happened with COVID-19 is that groups have been sidelined because people aren't meeting in groups, which has been, significant for support groups.
Right.
And my experience in this county, well, just in support groups in general, but I've lived here for a long time, is that people don't want to come to groups here. I mean, it's
Because it's so small and everybody
small,
knows
everybody
everybody.
knows
and-
someone, I have to drive 30 miles to get there. I mean, I've not, and this is just my experience, I've just not seen a lot of groups have traction outside of something like through the center. you know, Or through another agency this is a specific, domestic violence support group. Or, we've tried to do some support groups at the hospital, and they've had a little bit of traction for a while, and then that dies off after a few weeks.
Yeah.
Just hard.
And depending
things
on
are
the
hard.
nature of the group and
Right.
the content of the group, I think sometimes drives like
Right.
people's comfort in attending that group or,
Yeah, well, I participated in the parent support group that the Kids Clinic did this summer,
yeah.
or maybe it was in the school year. I can't
It
remember.
was,
It's
it
all-
was through the pandemic, so
Yeah,
we rounded up in May when school let out.
Yeah.
And should, heaven forbid, school have to go back to, schooling from home, right, is that what they called it?
Yeah.
We would put that back in place
Yeah.
again.
But I think it was an amazing resource.
Yeah,
Not a lot of people participated because it probably they felt like, well, I don't really know what this is about, and are you gonna judge me and my
Right.
Zoom behind me?
Right,
Like
right.
whatever their stuff was. But I applaud you guys for making the effort, and
Yeah.
I think it's needed for sure because it is a time, like you said, parents. Hey, by the way, school's not gonna happen. Starting on Monday. Probably, and so people are just thrown into a tailspin all across the board.
Yeah, the COVID-19 really threw a wrench in all the treatment.
Yeah.
But we are practicing at the center social distancing.
Yeah.
We're cleaning the treatment rooms, so we're taking those necessary precautions too.
Good.
So.
Perfect. Well, is there anything else that you want to touch on?
I'd like to touch on a couple of things. One
Yeah.
is kind of a segue to what Rich was talking about. So we all offer telebehavioral health services, which is that we can meet with patients, clients, people through at least through the hospital and our outpatient clinics. We can see them through video platforms, so someone can have a phone or an iPad or whatever, and we can see them over video. And we're also doing telephonic, so telephone.
Nice.
And so that actually has been that's been a blessing with COVID, because I've wanted that to happen for years, just given where we live, because it's hard for people to make it to the clinics. And this is, while we had some systems set up to do telehealth, it did not take off until the pandemic started, and that's been a really good thing. And we've had, Representative Soper push legislation through for that to continue, and the Behavioral Health Task Force had a special COVID unit, and they really looked at this is one of the positive things that we need to keep doing is telebehavioral health. So, and I also wanted to speak to our elderly population, of which we have a significant number of people in Delta County.
Yes.
And just wanted to touch on the social isolation that people who live alone or an elderly couple have, and it's tremendous. And so, again, just having contact with a neighbor or just checking on someone and seeing how they're doing makes a huge difference. People are feeling really lonely and really isolated. And I read a stat in the New York Times recently, and I don't know how they figured this out, but this statistic is predicting that 165,000 people will die from social isolation as a result of the pandemic.
Oh my goodness.
So it's huge.
That is huge.
So, yeah, and we don't know. You don't know what you don't know, so you don't know who's out there. So I think it's just, keeping that in mind.
Yeah, absolutely.
and there's a lot of research behind, if people can and have the time and means and have the creative means to figure out how to do some sort of service or volunteer work to those who could use it, that person benefits, but not as much as I get when we do that. Like that,
Right.
if you're feeling really anxious and about the world, like one of the best things you can do is find somebody to do some service for. Like it's gonna benefit them, but you're gonna feel so good about yourself that you forget about what you're worried about or what you're stressed about. So, and if you can figure out a creative way to do something for an elderly or someone,
Rake their lawn.
yeah, something. I mean, it doesn't have to be big, but like,
Split firewood.
is, you know, it's, you know, it absolutely helps you feel good about yourself and less focused on whatever you're worried about. I think the only thing I still want to touch on and add to is that I think it's really important right now that it's okay to ask for help. I mean, that's always okay. But I think we need to like really normalize, like maybe I'm not at my best, I'm not okay, and it's okay to ask for help, whether that's of a counselor, your primary care, or just like a family member of like, I need to take a walk, or can you help me do this? Like recognize when you're not okay and that it's okay to ask for help. And I think the other important thing that I would like to leave people with is if I notice that you don't seem like you're okay, like just checking in with somebody that you seem off, and I'm here for you if you ever want to talk, you need anything, goes a long way for the person if they're not feeling okay.
Yeah.
They may not reciprocate right in that moment, they may not take you up on it, and that's fine, but if you leave that open door of like, hey, I noticed you're not okay, like if I could do anything or help you, like let me know, like that communicates to somebody, like you see me and you cared enough to ask, like that also can go a long way.
Yeah.
And so, however, if somebody's actually in crisis, like let's go ahead and make sure we give those numbers. The local crisis line for the center is, and I should let you give it, but I'll go ahead and do it because I've got it written down, is 970-252-6220. And then the state crisis number is 1-844-493-8255. You can also text TALK to 38255.
Perfect.
So yeah.
Thank
But
you.
I think it's important that we give ourselves permission to not be okay and to ask for help and to make sure that we're checking on others if we're worried about them. I mean, if they've come up in your mind, they're coming up for a reason and better to check in on.
Yeah. How about you, Richard? Do you have anything else you want to touch on?
You know, I think like Becky and Stacy said it, you know, it takes a village, and I think checking in on your neighbors and just checking on people you know, and opening those avenues, you know, the primary care physician, your pastor, anything like that, I think will get you, open those doors for you.
Perfect. Well, thank you so much again for joining me this afternoon. This is great information. And I hope you have a good rest of your day.
Thank you.
Thanks, Darnell.